And good afternoon. I'm Dr. Deuk at the Deuk Spine Institute here in Florida. Our patient travels here from the other side of the state, and he had surgery already done at a place called Biospine. You can see the incision there. They did a laminectomy without removing his herniation, and he's now here to have the right surgery done. We've already numbed him up. He's laying on his belly, sleeping with propofol. Hopefully he stays that way. All right, I'm going to access the L5-S1 disc, and from there we're going to go in and fix that disc properly, and then we're going to do a piriformis release. Shot. All right, be a little bit more north. That's right. Luis has exposed a little more than we normally would at 5-1 because we're fixing the piriformis muscle next. That will be a separate stream right after we're done with this disc. He has piriformis syndrome. We'll talk about that later. For now, Henry.
Yes, sir.
Our viewers can ask questions if they want.
Of course.
And why don't we show them how do these disc herniations, bulges, extrusions, protrusions, ruptures, slip discs, how does it all equal back pain, leg pain?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. You can see from the animation, it's a tear in the back wall of the disc, lateral, that is the cause of all the back pain that people have related to a disc injury, when it is the disc that's the cause of the pain. Okay, we're here at the L5-S1 disc. We're just behind it, and Jordan is going to do two things. Number one, he's going to fix the WAG because we're off on WAG. You can see the two pedicles at L5 are offset. Now, the patient's disc was operated on, not the disc, but the lamina. He had a laminectomy done. I think it's worse, Jordan. I think it's a little bit worse. I think we need to correct it. You can see the two ears of the L5 superior articular process. That's better right there. But I think we're off on orbit by 1 degree, maybe. What I'm doing, I'm working with my x-ray technician who uses an x-ray machine to show us the spine and the needle. I think you went the wrong way on the orbit. And what he's doing is he's getting a perfect lateral view. All right, now that's almost 100% perfect. I think we're off just a smidgen on the WAG, or actually the orbit and the WAG by half a degree. Shot. That's good on the both. Actually, that's as good as it's going to get. Okay, very good. You can see the needle is at the back of the facet joint, and I just need to sneak around that facet joint to get to the disc. Shot. And there we go. We just did it. So now I'm literally pushing on the herniated disc. I can feel it. All right. How's our patient doing? Is he awake? Shot.
How are you doing, my friend? You okay?
I can feel your herniation.
You okay in there?
He has a big tear.
All right.
Big tear. Let's wake him up. So we're going to do a discogram next. We're going to find out how much pain is coming out of that L5-S1 disc, because, like I said, he went somewhere else and he had a surgery. They did a laminectomy. They took bone out of the back of his spine, normal bone, normal ligament, normal facet. They just drilled it away, and that was it. They didn't fix the disc.
How you doing, my friend? You okay? All right in there? Hi. Okay?
Let me know when he's ready.
His symptoms are foot neuropathy.
Yeah, he has numbness, but he will get more back pain if we don't fix this. You think he's ready? All right, let's proceed.
Okay, don't move.
How bad is that on a scale of 1 to 10? How bad is that?
What number?
Look at him wiggling around. It's like a 10. 10? Is that where you get back pain? Yes? Okay, good. All right, well, we woke him up. We tested the L5-S1 disc. You can see the giant tear. Jordan, show the audience the tear. Starts where the arrow is, goes all the way to the periphery. And it's his right leg that is really bad with the numbness. So we're going to get in there and remove the herniation out of the tear. We're also going to, you want to do some more num-num? We're going to treat his back pain as well as his leg symptoms. We're just giving you some numbing medicine. Now, while he goes to sleep, folks, this is a Deuk laser disc repair surgery. DLDR, okay? We're fixing the disc. Now, other doctors would recommend a fusion or artificial disc for this, but we're going to do it endoscopically with a tiny little cut on his back, 7 millimeters. When we're finished repairing the disc, we're going to turn our attention to his piriformis muscle. He's got a tear in the muscle. The muscle attaches from the sacrum or tailbone. It's a bone, sacrum. It attaches from the tailbone and runs down to the hip, all right? This is the piriformis. It is the third most common cause of lower back pain. After discs, facet joints, then there's the piriformis, and the last is the sacroiliac joint, or SI joint. So this muscle runs over to the hip and attaches to the top of the hip. We're going to release the muscle and get rid of his pain in his buttock. Now, is he asleep? Good. So we're going to make our incision. It's going to be a 7 millimeter incision, tiny. The whole surgery will be done through this. Henry, did we show the audience yet the how discs cause pain?
Yes, we did.
Let's show them how this surgery works.
Of course.
Facet joint injury is a common cause of chronic back pain. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. Now you see how we fix these tears. Jordan, can you show the x-ray again, or is it too late? Henry, are you able to pull up the last x-ray we did?
I believe so. Yes.
All right, Jordan will show you where the tube is in the disc. You can see the tip of the tube is at the deepest part of the tear, and then we're going to basically move this tube backwards, come out of the tear while we're cleaning the tear with the laser. It's called an annular debridement. Deuk Spine is the only one in the United States that does this that we know of. There could be other doctors doing it. I heard there's a doctor in California doing it as well. He's starting to do it. But also in other countries, I know there's some Indian surgeons that are doing it. So we have more and more doctors learning the Deuk laser disc repair technique and performing it. Okay. I know we have questions, but Henry, I want you to talk about Since this patient's got two problems causing his back pain, one being the piriformis, another being the disc, let's show the audience the 30 different causes of back pain.
You ready?
Copy that.
I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk. Thanks for joining us. Welcome back. So we've just watched a very useful video that shows people all the different causes of back pain. There are 30 common chronic causes of back pain, and we just showed them to you. Now, if you go to our website, deukspine.com, that animation you just watched is there, and you can use it and play with it and learn about the 30 causes of back pain. That said, the most common cause of back pain is a disc injury. Specifically, L4-5 is the most common. Number L5-S1 disc is the next most common, and then L3-4 is the third most common. So between L4-5, L5-S1, and L3-4, that's about 90%, 95% of disc pain comes from those three discs, okay? But check out the Deuk Spine website, deukspine.com, and you can spend as much time as you want learning about the 30 different causes of chronic back pain. Now, Henry, have we shown the audience yet how the Deuk laser disc repair works?
Yes, we did. Yes, we have.
All right, very good. So we've talked about the disc. 85% of chronic back pain comes from disc injuries. But where does the other 15% of those back pain come from? What are the other causes? The other cause that's second most common is the facet joint. Facet joints are paired joints located in the back of your spine. You saw that just now on the animation. And Henry, why don't you show the audience how do facet joints actually cause so much pain? And then when we come back, we'll take some questions.
Copy that.
And welcome back. You can see how facet joints cause pain. It takes an injury to the facet. That injury is traumatic. There's other causes of facet pain, like rheumatoid arthritis or psoriatic arthritis. And those are very, very uncommon causes, but they do cause facet pain as well. The most common is trauma to the joint. At the same time that the disc gets traumatized, the facets get traumatized. We're just about done with this disc, but before we finish, I want to take some questions, and then we'll finish off by showing you how we fix facet joint pain, the second most common cause of chronic back pain. How we fix it here at Deuk Spine, how the rest of the world should be fixing it if they were doing it right. It's not an RFA. RFAs do not provide permanent relief of pain. It's temporary. But we now have a permanent fix to facet pain. And we'll be done with this disc repair in about 5 minutes. You can see all the scar tissue right here. This is where the herniation is. We are literally in the herniation right now. I just took a big piece out a minute ago while you guys were watching, but there's still more herniation here, and I've got to get it out. So let's take some questions, and then we'll show the video on how we fix facet pain.
All right, first question coming from Lanu on YouTube asking, do you ever take a vacation?
Well, Lanu, I love vacationing, but I actually love helping people get out of pain even more. So I do. I take a vacation every morning before I come to work. I work in my garden, and I water my plants and fertilize them, and check them for diseases, treat them with usually fungicide or bactericide or insecticide if I need to. So my vacation is a working vacation. Unfortunately, I don't have a personality that allows me to enjoy just laying on the beach somewhere. I've never been able to do that. I've tried it. It doesn't work. I get bored very quickly, and I've got to do something. I do take vacations from time to time, about once a year with my family, and I really enjoy biking around the world. So I'll go somewhere and get on a bike, and I'll just bike for days and bike around the country and see things. be outdoors. That's my favorite vacation of all, just biking. I do love scuba diving, and I've been in the Caribbean, and it's very depressing going to the Caribbean and scuba diving now, because I've been going there since the 80s, and in the 80s there were lots of coral reefs, and all the corals are dying now from this disease that I discovered. And every time I go scuba diving now in the Caribbean, I get sad seeing all the dead coral. And but I still enjoy diving. I enjoy shark diving. And I do like to ski from time to time. Once a year I usually will take my kids skiing. But that's it. I don't do a lot of vacationing because I like my work. I will go see my children at the university from time to time as well, if you call that a vacation. But I consider it a vacation. Getting away from the humdrum of everyday life, right? I hope I answered your question, Lanu. Where do you live, Lanu? For some reason I feel like you live somewhere very far away, an exotic place.
I think the last time they said they were in the UK from last time I checked, or
Could be, yeah.
Turkey. Forgive me if I'm wrong.
I don't think Lanu is a Turkish name, is it? Maybe you're right.
It looks Turkish. The Lanu is the beginning of the name. There's more to it. I'm just so sorry I cannot pronounce it correctly.
All right.
Yes. So, but we do have two other questions coming from Brad on YouTube.
Before we do that, I just want to show you. This is fat right here. All right? This is fat. And why is there fat? Because we have fat normally around the nerves. The fat, specifically the nerve roots. Fat protects them. All right, B, this is going to be the more painful part for him. I can see he's already reacting just a little bit. So, all right, let's take the question from Brad.
First question from Brad asking, do you utilize a third-party anesthesiologist for your procedures, or are they in-house? Asking this for insurance purposes.
We use an in-house anesthesiologist. Dr. Berndes is our anesthesiologist, and he works for Deuk Spine just like I do. Good question.
Next question from Brad asking, do you utilize intraoperative O-arm navigation or some other form of neuro navigation when performing fusions?
Yes, I do not use the O-arm. It's unnecessary and it's dangerous. The O-arm carries a tremendous amount of radiation with it, and I don't recommend it to anybody. I have an opinion on the O-arm. I think if you need the O-arm to do surgery, you probably shouldn't be doing spine surgery. Okay, there's no need for the O-arm. I was trained prior to the O-arm, and I was trained on the O-arm. And I can tell you right now, you don't need an O-arm to do good spine surgery, the best spine surgery. I'm going to tell you, my fusion results are the best in the world in terms of complications and success and outcomes, safety. Nobody has the results I have for fusions. I've even published our results. You can look it up on PubMed, Dr. Deuk Majan. We have several publications, myself and my brother, on different fusion techniques. And my outcomes of spinal fusion are literally the best in the world. And I never use an O-arm because it's unnecessary, it's dangerous, it emits tremendous amount of radiation. It hurts the patients, hurts the staff. Most of the staff get out of the room. They won't even stay in the operating room when the O-arm is on. It's like a CAT scan in the operating room, and the patient gets fried. I would not want the O-arm if I was a patient. If my surgeon said we're going to use the O-arm, I would leave and find another surgeon like me who doesn't need it. You don't need the O-arm. It doesn't add anything. I mean, if you're not a well-trained spine surgeon, then you need the O-arm. But if you're a really well-trained spine surgeon, you do not need the O-arm. And if you're a spine surgeon and you want to learn how to do spine surgery like fusions without the O-arm, come see me and I'll teach you. There's no need for the O-arm. There's no need for robots in spine surgery. The best spine surgery is done without the O-arm. The best spine surgery is done without robots. There's some herniation there if you want to get it. Good question. Next question.
Next question coming from Charles on YouTube asking, I had ACDF surgery back in February of this year, and by April I started having lower back pain. Can I send you my MRI to see what you recommend, and could the ACDF affect my lumbar?
The ACDF would not affect your lumbar, but yes, I'd be happy to see your lumbar. I could tell you exactly what's wrong. All right, we're going to move on to the next surgery. It's piriformis. We're going to have to end this broadcast. If there are more questions, you can ask them during the piriformis. But let's end this and come back for our piriformis release.
Copy that.